Today I'm going to share a story where a small thing which was really meaningful and it makes a difference. So this can apply to all our lives too. So welcome back to another episode of Ride Along with me as we unfold everyday's events. I'm Dr. Prakash. I'm an emergency physician. My life revolves around unpredictable moments, a lot of mysteries involved, and the stories I create revolves around these true events and some small lessons that we learn from it. So these lessons not only apply to my field, that's medical field, it applies in general. So that's exactly the reason why I'm bringing it forward. This story revolves around a middle-aged man who was brought to the emergency that night. He was brought in by his daughter. He has been drinking continuously all day, all night for many years in his life. So one fine day his daughter decided that he should quit. So she emptied all the bottles and he was sober for around 3 days when she gradually noticed that the father was starting to have some tremors and they came to the emergency. Alright, so what we were actually looking at was classical alcohol withdrawal. The treatment is simple, but it does not finish with that. During the stay in the emergency, we offered an important injection which the daughter was having so many questions about. It was a vitamin. In the emergency, many patients come to the emergency asking, "Doctor, can I have a shot of vitamin? I need an energy booster. I need to feel fresh. I need to feel stronger." We often refuse such requests. We don't give multivitamins in the ER. But this is not the case. This is an important treatment in this aspect. I had to explain and make the daughter understand that this is a vitamin called vitamin B1, which is a thiamine, which is very, very important in her father's situation, because being a chronic alcoholic for so many years, thiamine will be gradually depleted from his body. Then she had another question. If it was depleted, why aren't there any signs, and why do you suspect the signs are going to come now? Alcohol has been suppressing his brains. It has decreased the metabolic demand of the brain for so many years. Once it is taken out of the equation, it's been stopped. Now the brain starts to get back to its normal function, whereas metabolic demand increases and it needs thiamine. Thiamine is indefinitely depleted. When you take food or when you take glucose, anything, it needs thiamine to metabolize. So more the glucose that you give, the more amount of whatever remaining thiamine is there in the body is going to be utilized and is going to land up in irreversible damage after that. Probably. There are conditions called Wernicke's encephalopathy. I don't want to bore you with these terms. Often they land into some confusion. Yes, alcoholics will be in confusion. They may have some ataxia, which means like gait abnormalities. Yes, alcoholics have gait abnormalities. They may have some abnormal eye movements. Yes, alcoholics can normally have abnormal eye movements even during a normal drinking episode. So how is this different from this? Unless proven otherwise in an alcoholic, these three things put together is a toxicity related to thiamine. That's Wernicke's encephalopathy. And it can get even further complicated, going to a psychosis causing irreversible brain damage. There's no going back after that. So however early you try to replace the lost thiamine, replenish that as quickly as possible, and it prevents them from having irreversible brain damage. So this was explained to the daughter, and then they were convinced, because they were initially wanting something stronger, something better, something out of the world kind of medicine to treat the symptoms. That's not the case. Something as simple as thiamine is all that he needs at that point. This is the lesson the story tells us. Often the small things that come ahead of us, we tend to ignore it. But they can be really meaningful. They can add up to something even bigger in life. That small thing that you have accumulated at that particular point of time could come out to be the most important thing that you have done a few days back or a few years back. For example, if you have just done one small course or something like that, you would not know that how that small degree has helped you. So anything, even if it is small, if it comes your way, if it is fair and legal, I think we should grab it with both hands and keep it along with us, unless it belongs to you anyway. She even asked me a question. Why hasn't he been receiving thiamine? Are we receiving thiamine normally in our diet? I also drink occasionally. I said, yes, normal food has some amount of thiamine. Foods like rice, especially brown rice, oats, fish, salmon, pork, some meat, a lot of beans and legumes, all of these have thiamine, but in minimal nutritional quality, what is required for day-to-day functioning. But in alcoholics, chronic alcoholics, the depletion is far more extent. and that cannot be replenished by the food that you take then. It has to be replaced by medical measures. So that's it. That's the story for today, and see you in my next ride.